So what is human development? So we have a two specified meaning for the human development. So first is that it refers to all changes that occurs in one's life from conception to birth. So technically it is the entirety of one's life from the first breath that he takes in earth and until the last breath. And for the next meaning is that an exploration of human capabilities, a widening of choices, an enhancement of freedom, and a fulfillment of human rights. So in life or in the entirety of our lives, it is not just about growing. It is also about learning. Learning from school, learning from life experiences, and learning from the people that we met or that we are gonna be meeting in the future. So that is what human development is all about. Next slide. Okay, so in human development, Eric Erickson's have proposed the stages of psychosocial development. This is for us to assess if um, what current stage we are experiencing and if we are in line with the right path. So first is we have the trust versus mistrust, which is occurring as early as an infant. And next is we have the autonomy versus shame and doubt, which is occurring during the toddler days. And the initiative versus guilt during the preschooler. And we have the industry versus inferiority during the grade schooler. And then identity versus role confusion during the teenage years. And we have the intimacy versus isolation during the young adult age. And we have the generativity versus stagnation during the middle age adult. And lastly, we have the integrity versus despair during the older adult. So to sum this up all, the stages of Erik Erikson psychosocial development is just for us to know or to assess ourselves if we are having an inferiority, or if this child is having an initiative instead of guilt, or if this old woman is having a isolation versus or an intimacy. So that is just what this Erik Erikson stage of psychosocial development is all about. So next slide. Okay, for the nature versus nurture controversy, we have the nativist, empiricist, and interactionist. So this tree controversy is actually just telling us that nativist is what we inherit. So next slide, please. So nativist is primarily what we inherit from either the genetics or maturation, and empiricist is acquired from external forces like or the environment, experiences or learning from other people, and interactionist is the combination of both heredity and experience. And next slide. Things to remember about human development. So we have four provided for you to know what is human development is all about. So first we have the object concept versus object permanence. We have classical versus operant conditioning. We have the ontogenic motor pattern. And lastly, we have the three systems of personality. Next.
So for the object concept and object permanence, so the object concept is the knowledge that the objects are permanent or independent, or the stability and existence of the object. And the object permanence is the things that exist even if it is out of view or it is hidden. And then next is the classical and operant conditioning. So for the classical conditioning, it is the type of unconscious or automatic learning where it is associated with an involuntary response and a stimulus. And then the operant conditioning is associated by a voluntary behavior or consequence. It is the type of learning that process through the strength of behavior is modified by a punishment or reinforcement. So next is the autogenic motor pattern. So this one is the sequence of the movement. So based on the age per month of the child. So just it says here that if the child reached 3 months, it will be able to do a prone and lift his or her head. For 4 months, it will be able to prone, lift chest with an arm support, and then for 5 months, it can roll over. For 8 months, it can sit without support. For 10 months, it stands with support and pulls self into stand. So for 12 months, it can crawls, and for 13 months, it can walk while holding onto a furniture, and by 14 months, it can stand alone well, and for 15 months, it can walk alone well. So next is the three systems of personality. So this one is from Freud's personality theory, which is structured into three parts, which is the ID, ego, and superego. So the ID is the energy constantly striving to satisfy basic drives, which is the pleasure principle, and then the ego, which seeks to gratify the ID in realistic ways, which is the reality principle, and the superego, which is the voice of conscience that focus on how we ought to behave. So thank you. So that's all that we need to understand and remember while we study for the human development.
The stages of the human development. In the first stage, it is the prenatal development that is subdivided in germinal, embryonic, and fetal stage. In germinal stage, it happens when the sperm cell fertilizes the egg cell to form a zygote. The zygote moves from fallopian tube to the uterus for implantation. Next is the embryonic stage. It is where the zygote implanted in the uterus and structures begin to develop and heart begins to beat. Next is the fetal stage. It is the finishing stage and birth. Next is the infancy stage. It is from birth to 2 months. Infants are extremely helplessness and need care from their parents. Next is the babyhood stage. It is from 2 months to 2 years. Babies are dependent to parents and their characteristics are next. It is the true foundation age, the rapid growth change, independency, individuality, period of socialization, sexual typing, appealing age, foundation of the period of creativity. Next is the childhood stage. It is subdivided to early and late childhood. The early childhood, it is from 2 years to 6 years. Major task that child learn is the toilet training. Next, they begin to distinguish right and wrong, and they develop quotients. Next is the late childhood. They are now more independent, and they start to socialize and form a group of friends. It is the age of conformity. Next.
Next will be the puberty stage, which in the puberty stage known as the closing years of childhood and the beginning of adolescence. Stages of puberty consist of 3 stages, which is the prepubescent, pubescent, and postpubescent stages. In adolescence, on the other hand, it's also known as the period of transition between childhood and adulthood. Characteristics of adolescence is the time of as known as the problem age. It is time of search of identity. It is also known as the dreaded age. It is a time of unrealism, and it's also the threshold or the boundary to adulthood. Next is early adulthood. In early adulthood, it's also known as the period of exploration and is the transition age. The features of adulthood is identity exploration, instability when it comes to career, self-focusedness also in terms of career, feeling in between, and age of possibilities. Middle adulthood is age of competence, maturity, responsibility, and stability. So characteristics of middle adulthood, the ages range between the ages of 40 to 60 years old. It's the time of meaningful relationships, and during this time, most of the time, it's complete increase of vocabulary skills of the individual. And lastly, late adulthood, which is known as the old age or second childhood age because of the dependency of the old people towards the younger people to take care of them. Characteristics of late adulthood begins at the ages of 6 years old until death, sadly. Have limited regenerative abilities and are more prone to diseases because of their old age and unable to take care of themselves. And that wraps up the stages of human development. Thank you.
So thank you, Sir Franco and Sir Nequinto. So today we're going to talk about what is the relevance of human development to physical therapy. So for me, there are three parts. So learn to interact. Second is to know more about problems. Third is to put life situation. First is learn to interact. So communicating in ways that are age appropriate. So let's say na our patient is in the middle childhood or late childhood. So in studying human development, at some point it can greatly improve your ability to interact. So you can put your insights and your thoughts about the late childhood or childhood. So second, to know more about the problem. So in human development, it helps us to gain understanding in knowing what's normal and abnormal. So as a physical therapist, you should know the normal and to distinguish the normal and abnormal in our patients. So in such, you can notice this through stages or ages in our patient. So last is to put life situation. So basically, it focuses on physical and psychosocial. Then last is to put life situation. So basically, it focuses on physical and psychosocial cognitive changes in our patient. So for next input, we have Miss Aijen.
Okay, so hi, I'm Aijen, and in addition to what Vince said, human development relevance to PT is to create greater form of independence and help contribute to the child's self-esteem. Since ang PT, napag-aralan niya kung paano yung development ng isang tao, isang bata, mas matutulungan niya to na ma-improve yung and maibalik yung maximum capability ng taong yon through range of motion, strength, flexibility, and movement pattern. And yung self-esteem na sinasabi dito is para ma-recognize din ng tao na yon yung pinaka the best na ability niya and nakaya niya.
Hi, I am Diane Ornum and this is my partner.
Hi, so I am Raymond Jr. A. Macadangdang.
What are the benefits of learning human development as healthcare professionals?
So, for me, the benefits of understanding human development across all healthcare team professionals is that it may help them provide a better understanding on the diagnosis they have to give to the patient. Human development may help healthcare professionals understand or know what may cause on the inability or what was the history of the development of the patient. Because of human development, healthcare professionals may understand what age a person may obtain the special skills and may help them find out the better diagnosis to provide a better and proper plan of care. So that's all. Thank you. So next.
We learn human development as to know how it affects the person and their connections to the possible illnesses of an individual may have. It also gives us an insight of the normal behaviors and developments that we know how it affects the individual, how the individual behaves, and we can also use this as a sign of early detection of abnormalities. We can also use human development as a way of personalization the healthcare plan of the individual.